Uber drivers, factory workers, and couriers. These are just some of the professions that could be most at risk of becoming new super spreaders of COVID-19.
People who move between different workplaces or different homes or different networks of people are people we need to be concerned about because they're more vulnerable, but also they're potentially at risk then of also taking the virus into a new workplace.
The coronavirus cluster at several McDonald's outlets in Victoria shows just how dangerous the situation can get. A dozen stores were closed when a delivery driver tested positive to COVID-19.
It's a difficult decision, but it's the right one to make.
The driver was asymptomatic at the time and unaware of harbouring the deadly illness. Several hundred employees from the McDonald's outlets were asked not to work for 14 days, and those employed casually are not being paid. It's a scenario that we're likely to see again and again as the government eases restrictions around Australia to restart the economy.
This is a disease pattern that tends to spread in clusters. So it's actually the risk of somebody bringing the virus into those settings where there's a lot of people working in or living in close proximity who then might be vulnerable to rapid spread.
Around the world, industries are grappling with COVID-19 clusters while they struggle to maintain social distancing requirements. The meat industry, for example, is being forced to confront hundreds of coronavirus outbreaks. In the US, more than 200 food processing plants have been affected, causing the deaths of at least 70 people.
If people let their guard down, that's the real risk. And then you can get these outbreaks that not only affect that workplace.
The Cedar Meats cluster in Melbourne is still growing 2 months after the first infection.
The proximity of people together, they're often very close together, literally side by side.
The reality is, some industries that support our livelihood cannot operate with social distancing requirements. Forcing restrictions on them can bottleneck the supply of essential goods and services.
We're looking at some possible reduction in food supply, but not necessarily shortage.
Certain industries have already adapted work practices to meet the expectations of consumers with contactless delivery, a term we've become used to. For postal deliveries, signatures are no longer required. And supermarkets have overhauled the way Australians shop. So how do we prevent future outbreaks? Experts say testing might not be the answer.
It's probably not realistic or feasible to continually get tested. If you're not positive this week, but you might have been exposed last week, do we test them again next week because they might still be incubating the virus? That's the real challenge.